I'm David Yu, and I'm the President and CEO of the Institute for Safe Medication Practices Canada. Our organization, ISMP Canada, actually receive a lot of voluntary reports from actual practitioners who were involved in error. I remember the time that I started the organization way back in 2000, and it's all finger pointing and a culture of blame. It's very, very prevalent at that time. And now we encourage folks to talk about their problem. Well, today I want to share a couple of stories that really impressed me and really intrigued me into the work that I'm doing as a pharmacist, as a provider, and also as someone who actually involved maybe indirectly into medication error that affect the nurse or the pharmacist. One case is the inadvertent administration of potassium chloride that a nurse was involved, and I was very much moved, by what happened, and knowing that this is a whole system issue that caused the error. I feel so sorry and so traumatic for the provider, the nurse. That was way back in 2003 that I was requested by the Chief Coroner's Office to be the expert witness in a inquest of the event of inadvertent administration of potassium chloride, a concentrate. I noticed that she actually was a very caring nurse. She's about maybe 40-year-old, a very, very caring nurse. She was actually trying to use normal saline to flush a line, and later on noticed that it was concentrated potassium chloride. Actually, the patient died almost immediately. The ampules of concentrated potassium chloride and sterile water and normal saline are almost identical. It's very, very easy to get mixed up. When I look at those situations and the conditions and how it's so terrible that it's a loss of life, but at the same time, I just feel terrible, for the nurse. I can see that this is not the nurse, performance issue or any mistake on her own. So I just couldn't help, the tear coming out from my eyes when I look at all those documents, and really tells me that I need to do something about it. One is all hospitals in Canada should ensure that no concentrated potassium chloride be accessible to any staff outside the pharmacy department. And the second recommendation we made, which is already fully implemented, that Health Canada should work with the industry, the manufacturer, to make sure that potassium chloride concentrate got to be redesigned in such a way that they're very distinguishable from other products. I've been involved in another case, actually a couple of years later. Again, the outcome was fatal. Is on a miscalculation of the infusion pump rate, causing a chemo drug to be infused, much more rapidly than was intended. The nurse said the pump supposed to be infused over 4 days, the rate. Somehow there's a lot of other issues involved, and she said it in 4 hours. I don't see the family had a lot of grudge against the provider, and which is a good thing, because I think we all know that they're actually the second victim. Yeah, I think in both cases, the nurses left their profession. We also work to improve the whole administration of vincristine, which is another chemo drug that has been quite a few times, not just in Canada, but all across the globe, that vincristine was administered intrathecally. instead of intravenously. The oncologist or the anesthetist is actually injected, to the wrong route. The best solution is more like a forcing function that connectors or the connection to both IV and to the fecal space or the spinal space got to be very different. It's like a key and lock. If the connection are different, is unique and not changeable, then you cannot fit it in. ISMP Canada has been viewed by nationally and even internationally, but something that we actually do some good work and then make some difference. One of the things that we do and do well is to connect with providers, the actual staff, nurses, pharmacists, or even physicians who contacted us, either by phone or email or in a report program that we created for individual practitioner reporting, is to tell their story. We keep that information confidential, encourage them to talk to me or to ISMP Canada, and then we will use their information to try to correct the system, because that would also be part of their goal that nothing of this kind will happen again. And I think this kind of support, a personal call and reassurance that we can do something about it would go a long way, because nothing will go to a black hole from a provider perspective. And this is what they want. They want changes. They want support. If I have one message to share, a provider, if they encounter or come across some mishap or event which is not a good outcome, tell yourself that you have done your best and try to report it. And collectively we can make sure that thing would get changed, and don't be afraid.